Okay, Dr. Rakhee, could you explain to us what is heat stroke?
So our bodies create a lot of heat. Normally, we have a cooling system through sweating and through heat dissipation through our skin. In very hot weather, this natural cooling system may not work very well. That's when the heat in our body builds up to very dangerous levels. This leads to heat illness, heat such as heat cramps, heat exhaustion, as well as what you asked, heat stroke. Our normal body temperature ranges between 36 degrees to 37.4 degrees Celsius. During a fever, the temperature can rise even more from 37.5 to about 40.5 degrees. Anything above that is basically a heat illness. Heat stroke, as you correctly asked, is basically caused by high temperatures, usually associated with high humidity, and is higher in countries like Malaysia, where our humidity ranges between 75 to 85%. Very humid, hot climate. Things that can cause heat stroke include exertion. So when you are working hard and out in the fields, or when you're going for sports, this is something important for children. When you're doing outdoor activities and sports, where your heat production basically exceeds heat loss. That's one way of getting heat stroke. Another one is sweating. Excessive sweating exceeding fluid intake. So especially in children, where children don't tend to drink much, even though they don't feel thirsty, they don't drink much, and that can actually cause them to have increased sweating and they lose more fluids through their body. First, heat wave. This is not very common in Malaysia because throughout the period, we are a tropical country, so we constantly have heat waves. This is more for climates that have 4 seasons, where from spring, summer, or from winter, it changes to a different climate, or traveling, so during vacation. So if you're coming from a cold country suddenly to a tropical country, your body takes time to acclimatize, right? So sudden changes in temperature, where you're going through a first heat wave, we call it, can actually cause heat stroke. And the last one is being inside a close confined area, such as a car, a steam tent, or in some cases indoors without air conditioning.
How does it affect children differently from adults?
It's a very good question. Risk of heat illnesses in children is much higher because of certain physiological and anatomical characteristics. For instance, heat production. Children have a much higher basal metabolic rate, BMR, we've heard of this being mentioned, compared to adults. Children produce more metabolic heat per kilogram, right? So they produce more heat, that's number one to remember. Number two, they have a greater risk of heat absorption from their environment because of their surface area. Children have a much higher surface area compared to adults. Children have a much more smaller absolute blood volume. So heat that is in our blood that wants to dissipate from its core to the surface area is much slower, and it happens much more slower compared to adults. Another important thing to remember is sweating. Children have a much lower rate of sweating compared to adults, which is why when sometimes you go out for sports, you see the adults start sweating a lot, but the kids don't sweat so much. And finally, fluid replacement. Children tend not to drink as much as they should, especially if they are unsupervised. They tend to get carried away with their sports or with their playtime, that they don't remember that they should be drinking or hydrating themselves as often as possible. So these are just several risks why a child would be much higher to develop heat illnesses compared to an adult.
So doctor, how can parents recognize the signs and symptoms of heat stroke in children?
Okay, so there are several signs of a heat stroke, but this is usually preceded by heat illness. So heat illness signs include excessive sweating, severe headache, which can sometimes be associated with nausea, weakness, dizziness, and then this progresses on to heat stroke symptoms such as confusion, vomiting, severe muscle cramps, pale skin, and of course an elevated body temperature. It's important for us to remember here that these symptoms and signs may be intermingled between each other, so you don't know when a child will move from heat illness to a heat exhaustion. So parents need to be aware that the moment you see any initial symptoms, take action as soon as possible.
What are the risk factors that increase the likelihood of heat stroke in children?
There are several risk factors. Age, for instance. Not necessarily in children, but also in adults. So we have to remember that our central nervous system, which our nervous system is one of the parts of the bodies that help us to regulate temperature. In very young children, this system is not fully developed. And in very old people, anybody that's above 65, this system does not work as it should. And it begins to deteriorate. This makes your body less able to cope with temperature changes, especially in your body. So that's one, age. Number two, exertion in hot weather, military training, participating in long sports such as marathons and football, where you participate in a longer period of time, especially outdoors. Sudden exposure to hot weather, especially when you're traveling between climates, or early exposure to heat wave, as I mentioned. Lack of air conditioning. We have to remember that fans are adequate in certain temperature, but above a certain level, when you're going through a heat wave, air conditioning is the only way that can keep the area cool and reduce the humidity. And in fact, lack of air conditioning in a hot environment is actually one of the reasons why elderly people get heat stroke. Another two more factors is medication and health conditions. These are usually in older children or in adults. Medications such as blood pressure medications, antipsychotic medications that can adjust your body fluids and your salts, that can actually lead to your body not being able to cope with, adjust your sweating and not being able to cope with the body temperature changes. Health conditions such as heart and lung conditions can actually lead to a higher risk of you developing heat stroke, or the history of you having a heat illness prior to this.
What steps can parents take to prevent heat stroke in their children during the hot weather?
So this can be divided into what you can teach your child versus what you can do as a parent. So we have to be able to teach our children to drink plenty of liquids frequently whenever they're going out and before and during activities, especially in hot sunny weathers, even if they're not thirsty. So this is something that parents need to be aware of. If a child's not thirsty, not showing symptoms of thirst, still every 15-20 minutes give them a drink of water or give them some fluids to drink, right? You also should teach children to come indoors during peak periods of hot sunny weather, and if they're feeling overheated, right? So children need to know if their body feels a bit hot or they're starting to sweat and they don't feel comfortable. Come indoors, take some rest before you go back out. Rehydrate yourself and before you go back out to play. Another thing that parents can do is to wear light clothing and light colored clothing. So we in our Asian concept, we like to wear dark colored clothes, black, dark blue, darker color, and that actually absorbs a lot of heat. So children should be in light clothing, light colored clothing, and minimal amount of clothing on a hot weather so they can dissipate the heat very much better. We should not forget children should also wear sunblock. So anything with an SPF of 15 and above that can be reapplied as often as every 2 to 3 hours, or even more frequently, especially if they're going swimming or they're sweating excessively. You can even reapply every 30 to 40 minutes, right? So if your child is going for a swim class and the class is taking longer than an hour, you might need to come out for a 5-minute break, reapply the sunscreen, especially if these classes are outdoors. Organize outdoor activities during off-peak hours, so early in the mornings or later in the evenings, besides the time when the sun is out at its full maximum capacity. The last point to remember is we should never at any point leave anyone, and I'm including adults and children and pets, in a car, in a parked car, even though you're in a shaded area, even though you've cracked the window open slightly. As long as your car is parked, not stationary, and there's no ongoing air conditioning, your temperatures can rise up to 11 degrees every 10 minutes. So this is very important for us to remember, because this is one of the main reasons why some children are dying of heat stroke or heat illnesses when they are parked in a car. In fact, when your car is parked in your own house, make sure you lock it so your child does not accidentally enter the car, lock himself inside, and nobody is aware where your child has gone as well.
Doctor, if a child is suspected of having heat illness, what immediate actions should parents take?
Okay, so as I've mentioned, the signs and symptoms of heat illness can vary, and it's a very grey area. So sometimes it's difficult for parents to understand whether their child is just having a heat cramp, heat exhaustion, or in a full-blown heat stroke, which is a serious matter. So I would suggest them to bring to the nearest clinic or emergency room if it's in the middle of the night, or call emergency medical help. right? So this is the first thing. While you're waiting for additional medical help to come, bring your child indoors, or if you're outdoors, bring to a shaded area. That's number one. Number two, sponge them or just douse them with cool water, not with cold water, with cool water. That will help to bring down the body temperature a little bit. And finally, do not give fluids to your child if your child is unconscious. You only should hydrate or attempt to give fluids to your child if your child is awake and alert. So even though they're awake but they're drowsy, not to give anything orally.
Doctor, can you explain the importance of staying hydrated?
Okay, so let me start off by saying sweating, right? Sweat evaporates off our skin, right? This allows for heat loss and cooling. This is our natural cooling system. However, when we sweat, we must remember that we're not only losing water from our body, we're also losing electrolytes, or what we call salts, such as sodium, potassium, chloride. And it's very important for us to drink enough water and electrolytes to replenish as we sweat. So that's something that a lot of us mistake, because it is very necessary for our body to function properly with adequate water and electrolytes. When working in the heat, or when outdoors in a play, or when you're doing sports outdoors, especially for children who are playing outdoors, it's very important for us to drink at least 150 to 200 mils of water every 15-20 minutes. So that's roughly about 600 to 900 mils per hour. This is the adequate amount for us to replenish whatever that we're losing, especially when you're working in heat. We must remember though not to drink more than 1.5 liters per hour, because that can cause other damages, because you're drinking too much water and that can cause other problems.
Doctor, how does heat stroke differ from other heat-related illnesses like heat exhaustion or heat cramps?
Okay, so when we're exposed to a hot environment, you develop heat cramps as the first sign, right? Heat cramps are basically just severe muscle cramps in your legs, in your calf muscles, any part of your lower limb, sometimes even in your stomach, where you have spasms in your hand, but without a fever. So you have muscle aches, body aches, no fever. But after your child or after an adult drinks a lot of fluids, these symptoms go away within a few hours. So remember our days when we used to do PE in school, you tend to feel very tired, exhausted, but we don't have a fever. So then once you drink your water, you continue back in class, you're normal back again. So sometimes those could be early signs of heat cramps. That's the first sign. If heat cramp is not properly managed, it can lead to heat exhaustion. So heat exhaustion can lead to pale skin, a lot of excessive sweating, nausea, dizziness. You can even lose consciousness, and you can be very weak, right? And these children or these adults can also have a slight temperature between 37.8 up to 39 degrees. And there's usually no fever, but you can have slight fever. So you can have either one of these symptoms in these patients. Most of the time, these are caused by dehydration because of excessive sweating. Remember, I said your body cannot control. And a person can progress from heat exhaustion to the next level, or the final serious level, which is heat stroke, very fast, very quickly. So sometimes it is missed. However, we have to know that all patients with any early or moderate signs of heat exhaustion should be seen by a doctor, because we are difficult for us to treat at any point, and mild symptoms must be treated as soon as possible. So you can start off with simple treatments at home by fluids and rest, but remember, if these don't resolve with your treatment, you must bring them to see a doctor. The final step in a heat illness is heat stroke, or some people call sunstroke. So basically, this is when you're hot, flush, you have a temperature of over 40.5 degrees. More than 50% of children actually do not sweat once they reach the heat stroke stage. These can actually cause confusion, coma, and shock. So when your body goes into shock, it is actually a life-threatening emergency, and the death rate is actually very, very high if not treated promptly and adequately.
What are the potential complications of heat stroke in children?
So heat stroke can cause damage to your brain, your heart, your liver, and your kidneys. These are all your vital organs. Through high temperatures, they can actually disintegrate or damage your muscles. Without any quick response to actually lower your body temperature, heat stroke can actually cause some of these organs to swell, and when that happens, it leads to permanent damage. We have to remember that without prompt or adequate treatment, heat stroke can actually be fatal. So a child or an adult, or even a pet for that matter, can actually die from heat stroke.
Doctor, do you have any last tips for parents?
Besides other parenting tips that I've actually mentioned earlier, where you decide the timing that your child should go out and all that, there are several tips that even I do at this point. When you go traveling, or when you're going to work and back, and you're traveling your child, you're bringing your child to clinic, or you're bringing your child to his daycare center, put your shoes at the back. Or in the beginning, I used to put one at the back and one in front, so I remember that I've got one to check in the back seat. Put your bags at the back seat. So at every point in time when you reach your workplace, you will definitely have to open your back door to check, to get your bags, to get your shoes and things like that. And that's when you can also visually see whether there's anybody in the back seat. There are newer cars also that are being developed, which has an alarm and a motion sensor in the back seat as well. So this one you can look up online and see which cars they are, where if you, as a driver, gets down from their driver's seat, it will actually alarm, and you are not able to close the door until you check your back seat and empty the back seat. So these are just several tips, additional tips to help parents, new parents especially out there. Always keep an eye, always have a system to double check. Like if it's you or your wife or someone, either one of the couple that is duty to drop off your child, have a way that someone calls you up and says, child has been left in daycare. Maybe get the school to just send you a text and say, Tom has reached school or something like that, So have a system in place where everyone is always just double checking each other.